Whether you're watching an elite athlete train for competition or someone in a living room workout, the lunge is a foundational human movement. It's a fitness staple that's been prescribed for generations. But despite its reach, it is also one of the most frequently botched. That gap between raw physical effort and proper biomechanical execution is dangerous. It can turn a highly effective movement into a fast track for joint pain instead of the metabolic engine it is meant to be. People usually ignore the discomfort and push right through the pain, chasing a systemic biological result, burning belly fat and overall weight loss. But the local physical cost of poor form is severe. We generally see two specific mechanical failures: knee valgus, where the knee collapses inward toward the midline, or the lead knee tracking dangerously far over the toes. This extreme forward shift is a significant problem. Instead of loading the muscle tissue, it places immense, shearing stress directly onto the delicate ligaments inside the knee joint. To access the lower body's metabolic capacity without destroying our joints, we must look beneath the skin at the exact anatomy driving the movement. A safe lunge relies on precise geometry. Look at this breakdown of the knee joint. The joint on the left shows severe shear force generated by a forward-shifted tibia, while the right shows the stability of a perfectly vertical, stacked shin bone. Standard forward lunges naturally encourage you to carry your momentum forward and over the toes, bypassing the targeted muscle groups almost entirely. That is why the reverse lunge is the preferred clinical alternative. By stepping backward, you naturally anchor the lead leg, keeping that front knee in vertical alignment and stacked safely above the ankle. This geometry protects the knee joint while driving the biological workload into the massive missiles of the posterior chain. During a lunge, the primary engines are the rectus femoris in the quads and biceps femoris in the hamstrings, but your trunk angle dictates how intensely posterior muscles activate. Notice the link right here between the lower back musculature and upper glutes. These graphs track muscular activation across trunk positions. Inclining the torso slightly forward causes a sharp spike in the lower lumbar erector spinae and gluteus maximus. Compare the first and fourth bars. An inclined trunk effectively doubles glute activation versus a straight back. This composite photo maps displacement for different lunge variations. Moving from a static to a dynamic walking lunge forces constant stabilization. Look at the horizontal arrows in panel C. Walking lunges actively decelerate your body weight with every step, maximizing leg recruitment. Refining your trunk angle and introducing dynamic motion transforms the lunge into a sequence that commands the largest muscle groups in the human body. Because the lunge fires so many massive muscle groups simultaneously, the biological energy demand is high. At a moderate pace, you are burning 5 to 7 calories every minute. To put that in context, an average 160-pound person knocking out a set of 100 walking lunges, we burn about 35 calories in just a matter of minutes. And this math becomes highly relevant when we talk about the ultimate fitness goal for many people: shedding stubborn belly fat. For decades, people believed in spot reduction. Like the man in this historical photo, we assumed that by exercising the muscles in a specific area, we could burn the fat sitting directly on top of them. Human biology simply doesn't work that way. Sit-ups will build abdominal strength, but the body draws energy from its overall fat stores. You cannot isolate and burn just the localized fat covering the abs. Since localized exercises fail to spot reduce fat, the only viable biological solution is creating a massive systemic metabolic deficit. Heavy compound lunges are designed to do exactly that. Fat loss relies on EPOC, excess post-exercise oxygen consumption. This chart plots oxygen use. See the workout's sharp spike and the long elevated tail. As it fills, this delayed burn repairs micro tears from heavy lunges, demanding extra oxygen and calories for 72 hours post-workout. That 72-hour sustained burn directly increases your total daily energy expenditure. You are literally burning more calories while you rest. This systemic energy deficit is the proven mechanism to pull energy from stubborn visceral and subcutaneous fat stores, forcing the lipid cells to physically shrink. Form dictates function. By protecting the knee, hinging the trunk, and embracing dynamic movement, the lunge operates as a systemic, fat-burning metabolic engine.